From the KSL Broadcast House, this is Sunday Edition with Doug Wright.
Good morning to you. Thank you for joining us on Sunday Edition. In the past week or so, we have been dealing with, the nation has been dealing with, the hurricane in the Northeast. We'll be talking about extreme weather conditions here in the state of Utah, of course, between the smoke from our own fires, but particularly from California and a little while ago from Oregon. We've been choking on those clouds of smoke. And what is going on with the changes in the weather and even extreme weather patterns? We'll be talking about that later on Sunday Edition. But of course, we've got to address COVID. As we look at some of the things that are going on, there's a real question, and there's a lawsuit right now. Is the state's mandate or law against mandates for masks, is it unconstitutional? Attorney Greg Skordas will join us later on in the program to talk about that. But first, there seems to be a battle. And I've heard politicians, I have heard medical professionals and scientists talk about their dismay that there seems to be a real rift. Politicians versus the health professionals and the scientists when it comes to what we do about masks, social distancing, vaccines, and so on. So we decided today on Sunday Edition, we would invite someone to be a guest on the show who is both a medical professional and scientist and a politician, and that's Representative Suzanne Harrison, who has joined us before. And I'm not going to call you Representative today. I'm going to call you Dr. Harrison. How does this make you feel as somebody with a foot in both worlds, politics and medicine and science, about these rifts and some of the belligerence that we are seeing around this issue of keeping one another safe?
Well, thank you for having me on this show, Doug. You know, it's really been disheartening. I took care of 2 COVID patients this week alone, and I spent time in one of our major hospitals this week as well. And our healthcare providers are exhausted and they're enormously stressed. And this pandemic is not over. And unfortunately, it's turned into a pandemic of the unvaccinated. Over 90% of the patients in the hospital are unvaccinated. And the caregivers I talked to this week are just begging people to get information from reputable, trusted sources, talk to your doctor, get vaccinated, mask up, and in a community that prides itself on looking out for each other, I really beg everyone to wear a mask. It's one of the best ways to help slow the spread of this disease, and more importantly, free up hospital beds in case you or a loved one has a heart attack or needs other medical care. Our hospitals are full, our ERs are full, and we need everyone to do their part. That includes the general public, but also it includes our elected officials.
Early in the week, Governor Cox brought together some fellow politicians, including our lieutenant governor, but also medical professionals. And as I watched that, I saw the frustration. As a matter of fact, it was our Lieutenant Governor Henderson, who said, now we're going back to school with, her words, fewer protections, fewer restrictions, fewer requirements, and a more transmissible virus. And then she went on to say, we are frustrated. I can only imagine, how frustrating this must be for those who are at the bedsides of those who have COVID.
Yeah. And the caregivers that I talked to today, many of them have children in our local public schools that don't have a mask requirement. They're terrified their kids are going to get sick, and that will make them so they're not able to go to work and care for your loved ones out there. So this is really something that we're all connected. We need to do our part, and we need elected officials right now to step up and act. It's not enough to have another committee, to have another study group. Our hospitals are at a breaking point, and we need action.
As you so rightfully pointed out, what brought about that conversation several days ago was the fact that our kids are going back to school. And those who are under 12, the vaccinations are not there for them. But this statistic really got my attention. Those who are between the age of 12 and 17 who can be vaccinated, The statewide average now is only 38%, and in some of the health districts, was the term that was used, it's down around 20%. So I really worry that our kids, even though often they do not get sick or terribly sick, they still carry the virus and can still spread it to those at home, to elderly grandparents and others who are in vulnerable age groups or situations.
You're right, Doug. And this week we had another pediatric death. A girl between the ages of 15 and 17 passed away of COVID, otherwise healthy. And these things, that's someone's daughter, that's someone's sibling or granddaughter. And these things have real impacts in our community, and we need action. Much of the school year last year, we were able to have our kids in school learning in person, which is really ideal. The difference this year is we're already starting with higher baseline case numbers amongst our kids, and we have no masks in the schools. And I think we need a data-driven approach that takes the politics out of this, that takes politicians out of it. And I would like to see implemented a requirement that if a school gets to 1% case positivity, that we have a mask requirement at that point to keep the community safe, to keep our hospitals functional, and to keep our kids safe. It's something that's data-driven and could be predictable. We need concrete action on this.
There were so many things that were so poignant and jarring. The word was used by more than one individual in that press conference, alarming. But I don't think I will ever forget when Dr. Harrison, the head of Intermountain Healthcare, described what he was dealing with. It is a cancer. He is in remission, thankfully. But then he looked out over the group that was gathered there in the Gold Room in the Utah State Capitol and said, and for those of you who are not wearing masks, I hope that you do not have the Delta variant, or you could possibly kill me. It doesn't get any plainer than that.
Right. It was a really poignant moment. And I think it shows that our medical experts talk to your doctor. We know that masks are an effective tool to help reduce the spread. They're not perfect, but they're one of the simplest measures we have. Vaccinating is very effective. And I think that juxtaposition between Dr. Harrison's expertise and then hand-wringing by politicians on the other side is really poignant. We need action now, and we need everyone to come together, put the politics aside, listen to the experts, and get some decisions in place to protect our kids, to keep our healthcare facilities functional and keep our economy functional, and ultimately save lives.
One final question, and I'll ask this of the politician side of you, with, of course, all the medical expertise. Could the Utah State Legislature do more, and have they tightened things down on different entities, including the governor, from declaring mask mandates?
Some of the bills that were passed this year really do tie the hands of local health departments and insert a level of politics that's really not helpful. We're seeing that this year. It's difficult for health departments to enact those protections that we know work, like masks in school when they make sense. And I think the governor and the legislature need to take action to, find a solution that's not just having another meeting or another study group.
Mm-hmm. Doctor, Representative, thank you so much for joining us. Suzanne, we always appreciate you being on Sunday Edition with us.
Thank you so much for having me, Doug. Stay safe out there.
You too. And coming up next, we're going to talk with Attorney Greg Skordas. You might recall he ran for Attorney General of the state of Utah. And is it unconstitutional here in the state of Utah to have a legislative piece of legislation that bans mask mandates? That's coming up. A group of parents who have children with disabilities have bonded together, and they have filed a lawsuit against the state of Utah. And what's it all about? Well, it's because schools cannot require or demand a mask mandate that the parents believe would, of course, keep their children safe while they're in school, and thus, because there are no mask mandates allowed in the schools, that it is preventing their children access to the free education, quality education that all Americans are guaranteed. Greg Skordas is joining us right now. Greg, do these folks have a legitimate beef with the state, and could this lawsuit actually overturn the no requirement of mask mandates?
Well, that's certainly our intent, Doug, and we've seen a huge uptick in COVID-related infections for kids under the age of 12, and our lawsuit is really limited to that group. We're talking about people who are unable, because of their age, to get a vaccine. They're not even 12 years old yet, so they're attending school in a setting where they cannot be vaccinated. And we're simply asking that if numbers get bad enough and if the situation gets rough enough, that the county health department and perhaps even the school district can impose temporary mask mandates for that specific group of kids, because otherwise it's just so dangerous for them and so harmful for them to attend school that a lot of their parents are simply not allowing them to do that.
It was interesting, the discussion about kids, and obviously the topic was kids going back to school in regards to COVID. But at the governor's press event, we had medical professionals, including someone from Primary Children's Hospital, who talked about how this is seeping down, and our kids are paying a price, and used this statistic. In May, he said the average number of children in Primary Children's Hospital for COVID was 0. And now, last week, it was 7 to 9 kids on average. In the weeks prior to that, it was 3 to 4 kids average. So we are digressing, to say the least. And so our kids can get it. Right now, if they're under 12, they are not eligible for vaccinations. Those 12 to 17 are, but the number that have availed themselves of the vaccine is rather pathetic at this time. So again, I would assume that puts some fuel under this lawsuit.
Exactly. And Doug, there's also been another misconception, and I don't know how it started, but there's some notion out there that kids in that age group are either less susceptible to COVID or less susceptible to having harmful effects of COVID, and that's simply not true. And I think that the doctors at Primary Children's and throughout the country will acknowledge that group, especially with this new Delta variant, are particularly sensitive to COVID, particularly vulnerable to it, and it's dangerous to them. And we've seen, as you just indicated, our numbers go up. You know, it's hard to imagine this, Doug, but our numbers for COVID on today, the early part of September of 2021, are worse than they were a year ago today. And for this group, this particular group of kids under the age of 12, it's 4 times worse. So we're not going in the right direction. If we were, we would have never filed this. But we simply need some mechanism in place so that schools can take reasonable precautions to protect their kids. And if you look at the statute, what it allows is 30 days. The health department can say, we want a mask mandate for 30 days. That doesn't seem like a lot. And then we can revisit it every 30 days and say, well, the numbers have gone down. We don't need it anymore. But right now, you can't impose a mask mandate for 30 seconds. And what we've said as well, unless there's an emergency, well, we're at that point. We're at the point where young people are suffering. We've seen a recent death of a young woman just within the last few days here, and our numbers are going up. And our group, our plaintiffs, have children who are high risk, who are disabled, who really, if they're exposed to this virus, Doug, it's a death penalty. It's going to be long-ranging. The effects are going to be horrible. And so these people just can't afford, for a lot of reasons, to put their kids in school. And a lot of people are arguing, well, they can just do school online. That's not true. Some districts don't offer that. Some schools don't offer that. And the medical professionals will tell you, and history will show us, that with specific groups, especially this group of young kids, at-home learning or online learning just isn't as effective. They need that camaraderie. They need to be in school. And all we're asking is a simple mask over your face just until we get this thing sorted out, until we get the numbers back to where they should be.
I think it is so alarming that we're actually in a worse position right now than we were 1 year ago. And you compare the statistics of May to where we are today. And when I was talking with Representative Harrison in our previous segment, I mentioned that our Lieutenant Governor Henderson said, and again, this is anticipating that we're in the first month of getting back into school, and she said we are doing so with fewer protections, fewer restrictions, fewer requirements, and a more transmissible virus. Boy, there's something we need to look at here pretty closely.
Yeah, and it's not like, I don't know, these anti-maskers and these anti-vaxxers have done just an incredibly good job of scaring the heck out of people into thinking that there's some sort of conspiracy or something going on here. We're talking about 11, 10, 9, 8-year-old kids who can't get a vaccine, even if they wanted to, even if their parents were begging for it, they can't. They're at risk. They're at risk. And the only thing that they have to minimize that risk right now that the medical professionals are comfortable with is a mask. It's a simple piece of cloth. It's not something that affects their breathing, affects their ability to speak, their ability to hear, their ability to participate in school. I mean, this is such a small thing. And it's become such a huge problem for us in this country. And we're one of, I think, 6 states that have filed these lawsuits. And we're one of 3 or 4 states that the federal government has come after and said, look, you're not protecting your kids. The feds can require that kids wear masks on school buses, and nobody says anything about that. But as soon as the state comes in and says, well, when you get off the bus and you walk into the school, you got to put the mask back on, it all goes through the roof. And I don't know how we got to that point, Doug, but we're just, if we can get the numbers down, we'll walk away from this lawsuit. We will walk away. But we want to be able to give these kids a constitutionally provided, safe, public education, which we believe is an individual right, which the founders of this state thought was very important. And that's why we brought this case in state court under state constitutional rules, because we think the founders of this state would have approved this exact measure.
Greg, it's always a pleasure to have you on the show. We'll watch this closely and keep us in the loop, won't you?
Absolutely. Thanks, Doug. Thanks for everything you do for our community.
Oh, that's so kind of you. Thank you. Greg Skordas. Coming up next, extreme weather conditions. What is really changing? What is myth? What is reality? We'll talk about that coming up in the next segment. In the last few months, it seems as the world has experienced extreme weather at a higher rate. Massive fires in Lake Tahoe, a tornado in Pennsylvania, flooding in Europe and Asia and Tennessee, and now Hurricane Ida blindsiding the Northeast, killing at least 30 people. We wanted to talk about the perceptions of and extreme weather conditions, and we're delighted to welcome from the University of Utah a professor and NOAA Science Advisory Board member, Dosha Poo. Thank you so much for joining us on Sunday Edition, and let's talk about the extreme weather conditions. It seems to many of us that there are more, and they're more severe than they had been in the past. Is that a true perception? Is that accurate?
Yeah, based on the recent IPCC, the Intergovernmental Panel on Climate Change report, so the human-induced climate change is already affecting many weather and climate extremes in every region across the globe. So this is true. We would expect more extremes happen now and in the future.
Often we think of these things happening far, far away on the Arctic Circle or on some other corner of the globe than us. Recently I heard it was Brad Wilson, who's the Speaker of the House here in the state of Utah, who said, I've lived in Utah my whole life, and I can tell you that things are indeed changing. I, too, have lived in Utah my entire life, and things are different than they were. So it's not just the far-flung places, things are happening right in our backyard. Is that accurate?
Yes, and first of all, as I just said, there are this climate and the weather extreme associated with climate change in whole world. And in the meantime, so we know the climate system is an interactive system, which include the several components such as atmosphere, hydrosphere, cryosphere, land surface, and biosphere. So any change in one of these components will have influence to the atmosphere because those components are interact each other. So then anything happened far away eventually will contribute to the whole climate system change or global change. So especially recently, due to the human activity, this human induced climate change seems to have severe influence to the climate and weather extreme everywhere. I think we actually well prepared for the average weather condition, which is Euro. What's our Euro condition? But we are not well prepared to adapt with these extremes. So the extreme events usually is something which seems like we have least chance to happen. But now we see those events happen more and more.
Your expertise is in predicting and forecasting, and as you look at the patterns that we are in now, first of all, how dire is it? And is it going to become more and more difficult for people like yourself to actually process and forecast what we can expect?
Yeah, I think this at moment, because of our forecast system usually developed based upon what we have and the resource we have. So certainly, because this extreme is not the Euro case, and so we don't have sufficient resource to support our forecast. So we will face some difficulty at the beginning, but with some more research, and especially when this report come out, and we know, so this is going to happen, and so if we do something like increase this observation and increase our understanding, and also continue develop our capability of the forecast, I believe in the future we can do a good job. So there is hope there. So this is not something we cannot.
Professor, we certainly appreciate you allowing us to tap into your expertise. Thank you for joining us this morning, and that does it for Sunday Edition, Music and the Spoken Word. That's coming up next.